colon, descending colon, sigmoid colon, and rectum, and upper part of the anal canal. All these are the parts of hindgut. So now suppose you are in Mashra and you got chance to open the abdomen. So whenever you will open the abdomen, first of all you will have skin, then you will have the abdominal muscles. You already know anterior abdominal muscles. Then you will have the structure like this. Okay, so in this structure, you will find that these are the loops of the intestine. These are the loops of the intestine. And you will find a structure which is mostly made up of fat. Okay, this is called as mesentery. This is called as mesentery. So what is the mesentery? So now here also you can see this is the mesentery. So in the mesentery, the coils of jejunum and ileum, they are present. If you will see any videos or any picture, you will find that ileum and jejunum, they are freely mobile in the abdomen. So is it freely, it is really free, or it has some attachment? So you will find, yes, it is freely mobile. Why? Because it is attached to the mesentery over the posterior abdominal wall. And this mesentery, it is very broad. It is very broad and fan shaped. Fan shaped means, do you know the Japanese fan, which has, if you make by paper, you will find one end is little broad and the another end is narrow. So like this mesentery is present, which has two borders. Okay, so this is the free border. This free border, it will enclose the jejunum and ileum. And it has another border which is the attached border. So what do you mean by attached border? Attached border means this will be attached to the posterior abdominal wall, to the structures of the posterior abdominal wall, and it is about 6 inches. But the free border, it is 6 meters because it is going to enclose whole of your ileum and jejunum. What is the extent? It will extend from the left side of the L2 to right sacroiliac joint. So we have this picture about this. Now here you can see these are the coils of the small intestine and these are the vessels which is going to supply the intestine. So you can see these vessels are also passing through the mesentery. So what are the contents of the mesentery? So first of all, it has the ileum jejunum. Then it will be having the mesenteric vessels, superior mesenteric vessels. Do you know the superior mesenteric vessels, inferior mesenteric vessels? Yes?
Yes, doctor.
Okay,
Yes.
very good. So we have the superior mesenteric vessels which will be present in the mesentery, and its small branches like ileal and jejunal, because it is going to supply the ileum and jejunum. So they will be present between the two layers and it will form the arcades and vasa recta. Okay, so slowly we will see what is the meaning of arcades and recta. So here, can you see, if you remember the upper limb, the brachial plexus. So if you remember that, you will find that not a single spinal nerve is directly going to supply like biceps, triceps. No, it is forming a sort of network. Then from the network, some nerve is going to supply the muscles. So here also you can see these arteries are making small branches, and these branches are forming the network, and then it is going to supply the your intestine. So now can you see this part? Okay, just look carefully. If you will see here at this part, only these branches, these small branches are supplying to the organ. But now if you see carefully here, you will find that these arteries are not going directly. It is making some sort of network. Okay, so these are called as arcades. These are called as arcades. So you'll find that here in this part the arcades are simple and here it is more complicated. Then what else? As if you take anything, so it will be having obviously some nerve fibers, sympathetic nerve fibers, some lymph nodes. So which type of lymph nodes will be? It will be mesenteric lymph nodes, and some fat, which is also varying from part to part. If you see the fat in the ileum, it has different amount. In jejunum, it has different amount. So let us talk about jejunum first. So mesentery is clear to everyone. So you should know what is the extent, what is the attachment. Okay. Now we have the jejunum. So where is the jejunum? So the part after the duodenum, you have the jejunum. So you will see it is occupying most of the left side of the abdomen, upper left. Okay, and this is the ileum which is present in the lower side, lower right. Here you can see that if you open the jejunum, you will find it has many folds. It has some mucosal fold like this, which will make the lumen very thick. Okay, thick and wide. So if you feel in the hand, you will see that there is something inside which is making it thick. So what is this called as? These folds are called as plica circularis, and this is one of the peculiar feature of the jejunum, presence of plica circularis. Then you will see, if you open, you will not find some lymph, very few lymph will be present, or even you cannot see with your naked eyes. And as just now I told you, this is the main artery which is supplying to the organ, to the jejunum. And after that, it is making some arc-like structure, which is called as arcades. And after that, it has vasa. Recta means, do you remember? Even I told you before, recta means something which is straight, going straight. So these branches are called as vasa recta, which is going straight. And these loops are called as arterial arcades because it is like arc. So in jejunum, you will find that arterial arcades are simple and the vasa recta are long.
The slides are not moving. We are still seeing the mesentery slide.
Oh, sorry. Just 1 second. Can you see now, Jejun?
Yes, now it's clear.
Okay, thank you. So here, I wanted to tell you, so here nicely you can see the position of the jejunum, which is present in the upper left side of the abdomen, okay, and the lower part ileum, which is present over the right side, mostly over the right side. Okay, then I was talking about the plica circularis. These are the folds which is present inside the lumen of the jejunum, which makes it thick. And it has no or very few lymphoid tissues. And here you can see what I was talking about, what is the arterial arcades and what are the vasa recta. And it in the mesentery of the jejunum, we have very less amount of fat. If you see jejunum again, this is the lower distal 3/5 part of the small intestine. If you compare with the jejunum, it's narrow, its lumen will be very narrow. And one very important peculiar features you can see in the ileum is the presence of the lymphoid follicles. Even sometimes you can see by naked eye, by your eyes also you will see some blue structures in the ileum. Okay, and this is the histological picture which is showing this lymphoid aggregation or lymphoid collection. This is called as Beer's patches. And here you can see that These arterial arcades, as I told you, these are more complicated, means one on another, one, two, like this. And its terminal branches are very short. And it has the large amount of fat present in the mesentery. So now if you have given the chance, because we don't have real models, I mean the real specimen, so you cannot touch and you cannot say which is ileum and which is the jejunum. Okay, it is ileum versus, okay, I will make this correction. It is the ileum versus jejunum. Okay, so we have the jejunum and ileum. So already I have told you all the points. The proximally to fifth you have jejunum, distally you have the ileum. The walls of the jejunum, it is thick, but the lumen is wide. What is in the ileum? You will find the lumen of the ileum is very narrow. The walls are very thin, and the presence of Peyer's patches, which is the one of the most identification point. Okay, the jejunum, its root will be above and left to the abdominal aorta. Its arterial arcades are simple and terminal branches are long. And it has very small amount of fat. Okay, and just opposite to this, you will find all in ileum. Okay, is it okay for you? If you remember this chart only, it is the same thing, whatever I have told you. Now next we have the large intestine. So the large intestine, it will start from where? So it will start from the ileocecal junction here. The ileum will finish and the cecum will start from here. So this is called as ileocecal junction. What are the different parts of the large intestine? We have the appendix, we have the cecum, then ascending colon, transverse colon, descending colon, then sigmoid colon, then rectum. Then we will have the anal canal. Now what is another thing, another findings you can see in this picture is the right colic flexure, which is also known as hepatic. Then the left colic flexure, which is also known as splenic flexion. Okay, now what else you can point out or you can find here, that these loops are not straight. Okay, it has some sort of saculation, sac-like appearance. These are called as hostrations or saculation. This word, hostra, hostrations or saculations. Then can you see one important thing here, this fat globules? Yes, these fat globules, they are called as epiploic appendages, okay, or appendices epiploici. These are the two important things. Then one more, another important thing is the presence of tinea coli. What is this tinea coli means? This one. Do you know the your histology of the GIT? The how the muscles are arranged in your GIT? Yes, anyone? The muscular layer, muscularis externa, which is known as.
It
Yes.
has longitudinal.
Is connecting.
Yes, it has. It has four layers, like all GIT have four layers. What are these four layers?
Mucosa.
Inner circular.
Yeah, very good. Inner circular and outer longitudinal. Okay. So this is muscularis externa. So we have four layers like mucosa, submucosa. Then, yes, Bayan, you want to tell?
The
Okay, so
muscularis
you,
layer.
Yeah, very good. So you will find out this. So what is this tinea coli? I want to just explain you what is the meaning of tinea coli. So here what will happen? The longitudinal muscle layer, it is arranged in three groups. Okay. In whole of the large intestine, you will find that the longitudinal muscles will be arranged in three groups. So it is called as tinea coli. What is tinea means? Three. Okay, it is called as tinea coli. So this is the one. Okay, like this you will get one here, one here. In whole of the large intestine, like this you will get three bands. These are the bands of the longitudinal muscles. Okay, so these are the three peculiar features. Now this is the picture of the small intestine and this is large intestine. So you can find out that this is the small intestine which has no circulation, and here you will find it has the appearance like a sac. Then it has the presence of the fatty globules which are called as appendices epiploiky. Then the third thing is the presence of the tinea coli. So these 3 points very important. If I ask you anytime what are the how you can differentiate between the small and large intestine, so you will tell that these three things are present in large intestine. Okay. So this is again a picture where you can see nicely these are the fatty globules, epiploic appendages. Then you can see the tinea. This is one. This is the number 2, this is number 3. Like this you will have three bands of longitudinal muscles. Now we will see about the cecum. So the cecum, where it is present in the right iliac fossa. Its diameter is about 7.5 centimeter. Now because you should know which organ is peritoneal, which is extraperitoneal, so you should know its peritoneal relation. So the cecum, it is completely covered. So now here you can see the cecum is completely covered with the peritoneum like this. So if you will remove, here you will find posteriorly recess. Okay, so this is called as retroperitoneal recess. Okay, or retrocecal. Here you can see retrocecal recess. What else you can see here in this picture? It is that the appendix, this is the appendix, which is coming from the posterior-medial wall of the cecum. So now if you cut the cecum, what you will see? You will see two important opening inside. The one, this is the lip-like appearance, which is the ileocecal wall. What about this opening? What will be this? Any idea what will be this opening? This
Tissue.
will
Opening of
be
an appendix.
very good. This is the opening for the appendix. Now, if you will see, we have a big model in which all the psoas major and iliacus muscles are present. So just tomorrow you will see that also. So what are the relations? So anteriorly, what will be there? Posteriorly, what will be there? So posteriorly, very important relations, you will have the psoas muscle and iliacus. Do you remember these two muscles? Even you have studied previously. Then you will have two important nerves which is going to the lower limb, that is the lateral cutaneous nerve of thigh and femoral nerve. What is the artery of the cecum? Anterior and posterior cecal arteries, which is the branch from the ileocolic. Okay, do you have any idea from where this ileocolic is coming? Okay, I will not ask. I know you all are tired from the quiz. Okay. So, but you will, inshallah, tomorrow just you will try to go through this lecture before your practical. So it will be easy. And don't worry for the arteries. I will explain you in the next slides. Then you have the next organ which is called as appendix. Okay. Its opening is just 1 inch below the opening of the ileum or ileocecal wall. Now if you see the appendix, this is the very small organ, but its size may vary from 0.5 to 9 inches. You can imagine 9 inches, it is too much. And this is one of the common organ which get infected and cause severe and acute abdominal pain. And why it is common? Because of its size and its position. It has different position in our body. It is formed in different position. Like you can see, these are the different position. It may be in front of the ileum, pre-ileal. It can be behind the ileum, post-ileal. Okay, it can go, or it is towards the pelvic, so it is called as pelvic. It could be behind the cecum, called as retrocecal. It could be below the cecum, subcecal. Okay, if you will see the books, you will find many more positions. But these are something which is common, and in which the retrocecal and pelvic sites are very common. Okay, so if I will ask you what are the commonest position for the appendix, so you should know the retrocecal and pelvic. These are the common site where you will find the appendix. The appendix is also completely covered with the mesoappendix. You can see here, this is called as mesoappendix. And the peritoneum of this appendix, okay, it is supplied by the 10th intercostal nerve, which is also the same nerve for the umbilicus. That's why always your pain of the appendix will refer to the umbilicus. Now there is one more important thing. Whenever you are examining to the patient of the appendicitis, you have to know that there is a point where the patient will have more tenderness when you will examine. So what is that point? That is called as McBurney's point. McBurney's point, and this point is this one. Okay, so where it is? So you have to draw a line between anterior superior iliac spine, obviously right side, okay, right anterior superior iliac spine to umbilicus. So this point is present between the medial 2/3 and lateral 1/3. Okay, so it is on the line between the anterior superior iliac spine and umbilicus. Okay, at the junction of the medial 2/3 and lateral 1/3 disc. Because why here you will have the maximum tenderness? Because this is the site for the base of the appendix. Okay.
Doctor,
Yes.
doesn't the appendix have several positions? So the base would be in different
No,
places?
the base will always be fixed. Okay. See, in this picture, you can see the base is always coming from the cecum, right? Its tip is moving, its body and tip is going in different direction. Okay, this is the base. Okay, the base is always fixed. It is coming from the cecum, posterior-medial aspect of the cecum. But it's different, its tip and body, it is in different direction. Okay, is it clear now?
Yes, thank you.
Okay, because the base is always fixed, so whenever there is a tenderness at the base, you can see that, yeah, could be the appendicitis. What is the blood supply? So obviously appendix will be supplied by appendicular artery, which is a branch from the posterior cecal artery. Now we have the ascending colon. So ascending colon, this is about 5 inches long, and where it is present in the right lower quadrant. Then it will take a turn towards the center and make the right colic flexure. Okay, and here it is in very close relation to the liver, so you will call it as the hepatic flexure also. And it will be covered with the peritoneum from the front and as well as from the sides. It will be having the tinea coli. Now you can see this is the tinea coli. So one is anterior, one and two will be posterior. So you can see these are the anterior tinea coli. Okay, what will be present posterior to the ascending colon? You will have the muscles like iliacus, quadratus lumborum, transversus abdominis, then iliac crest, and it is also related with the lower pole of right kidney, iliohypogastric and ilioinguinal nerve. What will be the arteries related here? Ileocolic and right colic branches from the superior mesenteric artery. Okay. Just 1 minute for return. So, okay, so these are the structures present posterior to the our ascending colon. Okay, so we have a model. You can see these posterior structures. Maybe nerves are not present, but muscles you can see. Now, the right colic flexure, as I have already told you, it is also called as hepatic because it is in relation with the liver. Okay, so anteriorly it is related with the right lobe of the liver and posteriorly with the right kidney. Now about the transverse colon. So transverse colon, it has two parts, right part and left part. Why I'm mentioning it specifically? Because here you have division for the midgut and hindgut. Okay, the proximal 2/3 will be the part of the midgut and distal 1/3 will be the part of the hindgut. So the right part it is retroperitoneal and left part it is completely covered with the mesentery, and this mesentery it is called as transverse mesocolon. So anteriorly you will be having greater omentum and anterior abdominal wall. Posteriorly, see, here we have cut the transverse colon. So what is there posteriorly? So posteriorly we have the second part of the duodenum and also the head of the pancreas And here you will have the some coils of the ileum and jejunum. Now, as it has different embryological origin, so obviously its arteries will be different. What is the artery for foregut? Any idea? Yes? Celiac. What is for midgut? Superior mesenteric. What is for hindgut? Inferior mesenteric. Okay, so its proximal part will be supplied by middle colic artery, which is a branch from superior mesenteric. And its distal part will be supplied by left colic, which is a branch from inferior mesenteric artery. Now we have left colic flexure, which is in relation with the spleen. Okay, so anteriorly it is related with the spleen, and posteriorly you will find the diaphragm. Okay, one important thing about this is that it is connected to the diaphragm. It is connected to the diaphragm by the ligament, which is called as phrenicocholic ligament. Okay, what is the phrenicocholic ligament? It is the attachment, okay, between the diaphragm and colon. It is the peritoneal fold which will attach your colon with the diaphragm. Now we have the descending colon. It is about 20 to 30 centimeter. Okay, and it will be continued till the pelvic brim. Okay, after the pelvic brim, it is curved to become the sigmoid colon. It also has the tinea coli, obviously, and it is also covered from the peritoneum from front and side. What are the relations? What will be present posteriorly? So same, it will be having muscles. Which muscles? The same muscles. The iliacus, left side, left psoas major. Then it will be having the quadratus lumborum, transversus abdominis muscle. Then it will be having iliohypogastric nerve and ilioinguinal nerve. In the upper part, in the lower part, obviously it will be having the lateral cutaneous nerve of thigh and femoral nerve. Do you know all these muscles? I think yes, because you have already done the muscles of the anterior abdominal wall. What are the arteries supplying to this? So it will be supplied by left colic and sigmoidal branches of inferior mesenteric artery. So this is also a very nice picture where you can see the relation of the colon. Okay, so this is the ascending colon. You can see all the nerves, all the muscles, and this is the descending colon. Now, if you will see, these are the ascending and descending colon. So the mesentery is arranged in such a way that it will form the gap on the medial side and the lateral side. Here also on the medial side and lateral side. Okay, so these are called as gutters. So here you can see you have the gutters, paracolic gutters. So we have the four paracolic gutters. So this is the ascending colon. So one will be medial here and one will be lateral. In the descending colon also one will be lateral and one will be medial. Okay, so I think this location is clear. So you will have the right medial paracolic gutter, this one. Okay, so it is completely closed. Then you have the left medial paracolic gutter, this is also closed. Then you have the right lateral, this one. This is very important. Why? Now if you can see, then you will see that it is here in continuation with this, because here it is liver and this is the diaphragm. So it is in continuation with the subphrenic abscess, subphrenic space. Subphrenic means the space below the diaphragm. So any infection or any abscess, it may enter here. Okay, so here you can see this is the person which is having some abscess. Okay, so from the subphrenic abscess, it is coming to the pelvic region like this. It is coming to the pelvic region. Here you have the pelvis. Okay, so for this, the patient will be giving this position at the 45-degree elevated. So if the patient will sit in this position, it is the way, natural way for drainage of this abscess. Then we have the sigmoid colon. Okay, so this will be from the sacrum, from the third piece of the sacrum to the as continuation of the rectum. Okay, so where it will start from, where? From the pelvic brim. Okay, and then S3, at the S3 it will become the rectum like this. It is curved part. So this is also, it has also peritoneum. Okay, this peritoneum, it is called as sigmoid mesocolon and it is inverted V shape. Okay, it is completely covered with the peritoneum. What are the arteries? These are the sigmoid branches of inferior mesenteric artery. So now here you can see the foregut, artery of the foregut, artery of the midgut, and artery of the hindgut. What is the origin of the celiac trunk? From the T12, this one. Okay, what is the origin of the superior mesenteric? Just below, from L1, this is. And inferior mesenteric at L3. Okay, so this all, now you know what are the parts of the foregut, midgut, hindgut, right? Now, what I want to tell you important here is this network. So first of all, this is the superior mesenteric artery. So this superior mesenteric artery, because this is the artery of the midgut, so first it is going to give some branches to the ileum and jejunum. Okay, just listen to me carefully because this is very important. First of all, it is going to give branches to the small intestine, ileal and jejunal branches. Then you will see that it has another branch, this one, okay, which is called as ileocolic artery. Okay, so this ileocolic artery also will supply to the ileum and colon, right? So this ileocolic artery here, it will divide into the cecal branches also, anterior and posterior cecal artery. And the posterior cecal artery will give the appendicular artery. Then if you see the next branch, this one, number 2, this is called as right colic. Then this is the branch which is called as middle colic. Okay, so right colic is going to supply ascending colon. Middle colic is going to supply the proximal 2/3 of the transverse colon. So what about the distal 1/3? It will be supplied by left colic artery, which is a branch from inferior mesenteric artery. Okay. Then inferior mesenteric artery also will give 5 to 6 sigmoidal branches, which is going to supply the sigmoid colon. Then finally, inferior mesenteric artery will continue as the superior rectal artery, which is going to supply the rectum. Okay, so in short, if you will see these arteries, the colic arteries, here you have which colic? Right colic. Here you have left colic. Here you have the middle colic. So these colic arteries are making a sort of circle here. Okay, they are anastomosing with each other and it is forming a circle. This is called as marginal artery. Okay, this one, this whole circle, this is called as marginal artery. What is the marginal artery? This is the anastomosis of the colic arteries. Okay, the ileocolic, the right colic, the middle colic, the left colic. Okay, around the concave margin of the large intestine like this. Okay, and this single arterial trunk, it is called as marginal artery. Okay, it will start from the ileocholic junction from here. Okay, so here it will anastomose with the iliac branches of the superior mesenteric artery, and then finally it will end and it will anastomose with superior rectal artery. Okay, maybe because of the short of time I'm going fast, but in practical, inshallah, we will discuss it again. But this is very interesting and inshallah easy also. But you should know the names and from where it is coming. Then we have the rectum, so it will start from the S3, okay, as the continuation of the sigmoid colon, and just it will end 1 inch below the tip of the coccyx and it will become the anal canal. Okay, so this will show the curves around the you can see here it is not straight here. Okay, it is showing the curves around the concavity of the sacrum. Here also you can see this is the sacrum concave and the rectum, it is completely inside the concavity of the sacrum. Okay, so it has the 3 lateral curves and 1 dilatation which is called as ampulla. Now, if you remember the tinea coli of the colon, so here, no, here it is different. Here the tinea coli of the sigmoid colon will become only 2 longitudinal bands. Okay, here you don't have 3 bands. Here it will be only 2 bands, which is anteriorly 1 and posteriorly 1. So this is the difference from the other colon, other part of the colon, that rectum has only 2 longitudinal muscle bands. Okay, so if you open, you will find longitudinal and semilunar folds like this. Okay, these are the semilunar folds. Just upper, middle, and lower. Now, in the rectum, you will find that the peritoneum in the upper part, it is present on the front and sides. In the middle part, only front. In the lower part, the rectum is not covered with the peritoneum at all. So here you can see nicely, this is the rectum. Okay, so this is the upper part where you have the peritoneum in front and in the side. And this is the middle part only in front. This is the lower part which is not covered, because from here the peritoneum is reflected over the uterus. Do you remember this figure? Yes? Yeah, this is the female sagittal section of the pelvis. This is the male. So here the peritoneum will be reflected from the rectum to the uterus. Okay, and it will form the recto-uterine pouch. And this is the male, and here also it will be reflected over the urinary bladder to form the rectovesical pouch. Okay, so this picture is also very important. You have anterior relation, posterior relation. So this we will see in the practical. Okay, or maybe you can take it as a homework to just read it out. Okay, from this picture itself you can read out what is anterior, what will be posterior. Okay, so what is important here to know about the arteries of the rectum? So the rectum is receiving the blood supply from 3 different sources: the superior rectal artery, the middle rectal artery, and the inferior rectal artery. These arteries are coming from 3 different sources. Superior, it is the continuation of the inferior mesenteric artery. Okay, it will supply mostly the mucous membrane. The middle rectal, it is a branch from the internal iliac, which is supplying the muscular cord. And the inferior rectal, which is the branch from the internal pudendal artery. Okay, so like this, you have 3 arteries and from 3 different sources. And veins, yes, you have the 3 veins, same name, and they also will go in the veins of the respective name. Lymph nodes, also you have superior, medial and rectal lymph nodes. Okay, so here you can see the superior, middle and inferior rectal lymph nodes. What is the nerve supply? So this we will tell. The nerve supply is from the vagus. Okay, and if you remember, the vagus nerve will enter into the abdomen by the opening from the diaphragm. Okay, and it has the splanchnic nerves, okay, which are known as the pelvic splanchnic nerves. Now we have the rectal examination. So digital rectal examination, which is also called as per rectal examination. So what you will do here in the rectal examination, okay, so obviously with the gloved fingers it is inserted into the rectum. As today even I asked to my students, what you can see, what you can feel by your rectal examination. So in the males, you can see the contents of rectovesical pouch, if there is any tumor, any mass or any fluid. You can feel the posterior here, posterior surface of urinary bladder, and also the seminal vesicle as well as prostate. Okay, then urogenital diaphragm, which will be present here, and perineal body. So not only the anal, also you can find or you can just palpate these structures on the rectum if there is any mass over the rectum, if there is the prostate is enlarged. Okay, and in female you can see, if you examine here you can reach till here, okay, which is called as recto-uterine pouch. Here also the rectal examination, you will see if there is any tenderness, in there is any fluid in the recto-uterine pouch. Okay, you can palpate vagina, cervix, urogenital diaphragm and perineal body. Okay, so these are the structures you can examine by the per rectal examination. Okay, this is called as rectal prolapse, like this. When the mucosa of the rectum, it will come out through the anal opening. So this is, we have this model. Do you have this model in the boys side? Previously also you did not reply me for the duodenum model, Muhammad. Do you have this model?
We have this. Yes.
Yes, so please try to see this model, okay? And just this is the picture I got, it is without label. So maybe you can take homework and you can just label it and bring it to your lab, okay?
Okay.
Yeah, you want to ask anything?
No, thanks.
Okay, so maybe maybe you did not understand anything or you understood everything.
No, it's clear.
Okay.
But
Yes, I know. Yeah. I know you because there were quiz, so maybe you are disoriented, and I rush little fast because I have to complete everything. So Alhamdulillah, I tried to finish, but there are many important things which you can even see in your practical session. Okay. So just keep the slides open and just try to see the model. Okay. Inshallah, your doctor will show whatever models we have present. And just whatever pictures I have told you, just try to focus that also, because some models we don't have, but we should know. Okay. Okay, thank you so much. Anyone has any question?
Thank you very much.
Okay, thank you so much and good luck.